Hi everybody, my name is Temitope Olasehinde, and I am a 2023 to 2024 Jean Capello Health Advocacy Fellow. And my capstone will be revolving around advocating for health equity through digestive disease research. So a little bit about my advocacy journey. Growing up in Nigeria, I recognized from a young age that there was a long-standing history of health inequity woven into the fabric of my community. When I immigrated to Canada, I witnessed many of these disparities mirrored in the healthcare of the many people I encountered there, and this was subsequently continued when I immigrated to the US for medical school. In my undergraduate years as the Ethnocultural Support Services Coordinator, I created many advocacy initiatives to support members of my community. This included This Mind of Mine, which was an online social media campaign and movement that amplified and advocated for the mental health needs of students and community members. Solidarity Against Islamophobia, which is where we stood with our Muslim brothers and sisters in solidarity against the fire set on a mosque in our community. And lastly, SOS, or Stories of Syria, which was a campaign that advocated for the rights of Syrian refugees in our community during the Syrian refugee crisis in Canada. So how it all began. While in medical school and residency, I developed a passion for gastrointestinal health. This, coupled with my experiences advocating for underserved and minority populations, served as a catalyst for my research. Notably, last year I investigated the risk of colorectal cancer in incarcerated patients with inflammatory bowel disease in the United States. This study showed that the patients with IBD who were incarcerated were more likely to have colorectal cancer than those who were not. This became an eye-opening moment for me and showed me the significant care gaps that this vulnerable population suffers from. While writing my research paper for this, I began to look into reasons why these disparities were happening in this population, and why more was not being done, which led me to a path towards DFA and advocacy. As a Jean Capello Fellow, I utilized the skills I was learning in our sessions to find ways to advocate for these populations on a larger scale, using the findings informed by my research. Through this, I became the Doctors for America Decriminalization and Liberation Committee co-chair. In this, I led and moderated a panel discussion focusing on the challenges of re-entry and reintegration of incarcerated individuals back into the community. I am also helping develop initiatives and programming around criminalization of mental illness, asylee/refugee health and detention camps at the border, and the intersection of women's reproductive rights within incarcerated settings or incarceral settings. While investigating systemic barriers affecting the health of incarcerated populations, I discovered the Medicaid inmate exclusion waiver, which could possibly help these individuals get care and transition back into their communities. Compared to the general population, individuals who are incarcerated have higher rates of mental illness, substance use disorder, and chronic disease. However, the federal inmate exclusion policy prohibits Medicaid coverage for people who are incarcerated. When people leave incarceration, they are at greater risk of overdose death and suicide, hospitalization, and emergency department use. With this partial waiver of the inmate exclusion policy, these individuals will have a smoother transition back into the community with re-entry services and will help aim to improve healthcare transitions, increase continuity of healthcare coverage, reduce disruptions in care, and reduce recidivism. While doing my research, I realized that Ohio was one of the states that had not even gotten this waiver approved or pending. With this information and the assistance of the National Association of Counties, I crafted a letter to the representative of the 11th Congressional District of Ohio, Shontel Brown, to urge her to support bipartisan legislation that amends the Medicaid exclusion policy in Ohio and applies for this partial waiver. In addition to these advocacy efforts, I attended DDW, or Digestive Disease Week 2024, where I went to Washington, D.C. and met up with other advocacy champions to discuss ways to better further advocate for the digestive health of our patients. This provided me with the opportunity to present my findings on the effect of a patient's primary language on IBD outcomes, which is an issue that would disproportionately affect immigrants, refugees, and minority populations. I advocated for this increased awareness of these issues via a disseminated social media interviewed video, which you can see above. These efforts were ultimately crowned with a top award in healthcare disparities to recognize outstanding work in bringing awareness to racial and healthcare disparities. In April 2024, I became a Fight Colorectal Cancer champion, which is a national organization that focuses solely on the advocacy for colorectal cancer. With this, I drafted a letter to my representative, urging her to support colorectal cancer research at the Department of Defense. Why is this so important? Colorectal cancer is the second leading cause of cancer death for men and women combined. And while the incidence rates of colorectal cancer have largely stabilized in patients over the age of 50, they're rapidly increasing in individuals under the age of 50. And of the top 5 cancer killers, colorectal cancer is the only cancer not to have its own program within the Congressionally Directed Medical Research Program, which is absolutely critical as a strategic approach and dedicated funding is imperative to fighting this disease. So where do we go from here? I plan to apply for gastroenterology fellowship this upcoming summer to further continue my goals of advocating for health disparities in the GI space. I am also planning on joining an advisory committee on the Fight Colorectal Cancer team to utilize my research and clinical experiences to inform colorectal cancer policies. I also plan on becoming a congressional advocate through the American Gastro Association to help drive GI's legislative agenda forward on Capitol Hill. And lastly, I plan to attend the upcoming call on Congress to further prioritize colorectal cancer advocacy in Washington. Thank you.